is Gabriella Van Beek, and I'm the Operations Manager for HealthWatch North and West Northamptonshire. And I've been in this role for about 2 years now. And actually, previous to this, I worked with another HealthWatch that was in Lewisham in London. And before that, in my past few years, I've been able to get a bachelor's in biomedical sciences and a master's in public health.
Hi everyone, my name is Roz and I am the Community Connector working for HealthWatch on the Eastern European project. We've been invited to a lot of events, we hosted a lot of events, and we had been achieved like a great connection with all the Eastern European communities.
Cred că a avut un mare impact în comunitatea noastră și a ajutat foarte mulți copii.
Hi, I'm Kate Holt. I'm the Chief Executive for HealthWatch North and West Northamptonshire. The East European Research Project, it's being funded by NHS England, and we're working with the Northamptonshire Integrated Community Partnership, looking at why East Europeans across the county don't engage in research. So we're bringing the community together to find out more about what their views on health and social care are and how they can be involved in research going forward.
And so at the start of the project, I think I expected to have some success in sort of finding those connections within our communities, and also I expected to attend events and work on building those relationships, as well as having some success in actually speaking to people about research. This project has really helped me develop my personal skills, I think, around communication, and around sort of relationship building. And it's just been such a fantastic project to be a part of, because it's allowed for us to kind of communicate with so many different groups locally, and kind of with our community mapping exercises and our presence in the community, on the ground actual work. It's allowed us to develop a lot of relationships that I hope will be lasting. But communication was so key there, as well as just sort of that trust element. So I think it's helped me improve the way that I interact and the way that I pass on information to people.
One of the skills that I developed working on this project was understanding people's needs without judging them, just listen to their issues and trying to help them as much as I can. I will use this skill into my career and my personal life as well, because listening to people and trying to help them without judging them is a huge skill.
We've just finished coming to the Ukrainian group, where people come together who are from Ukraine and they share their experiences and learn English. So we brought our information about our project here to share with everyone. It was so lovely to talk to everyone today, and we had some great conversations about local health and social care.
For some people it's difficult because some of them have a language barrier, some of them just shy for ask about health. And it's not about physical, more about mental health, and a lot of people who arrive here from Ukraine, they arrive just because they must.
inequalities, and also a little bit of an exploration into a national and community sort of aspect on what health inequalities mean, and a little bit about how our local sort of local authorities and NHS is structured to get a better understanding of what these health inequalities are like for us locally here in North Carolina.